Welcome to the Research Hub podcast. The Research Hub translates research into action, turning science-backed insights into practical strategies for coaches, gym operators, and anyone leading people through fitness. I'm Dr. Karlie Intlekofer, and in this episode, we're tackling the challenge that many fitness facilities face. That's the communication gap between members and the fitness professionals that serve them. And with the insight of our guest today, we'll explore how to close this gap to create more inviting and inclusive spaces. Our guest today is Dr. Nina Crowley, a nationally recognized expert in obesity care with a doctorate in health psychology and credentials as a registered dietitian. Nina brings clinical insights and behavior science together to support lasting behavior change. She currently leads clinical education and partnerships at SECA and serves on the board of directors for the Obesity Action Coalition. Nina, welcome.
Hi, thank you so much for having me.
So I'm sure some of the guests are curious about your background. So let's start with your journey. What first drew you to this type of work?
Okay, well, I will try to be as quick as I can there. I kind of always knew I was interested in nutrition and psychology. I actually did one of those really old school aptitude tests a long time ago, and that kind of came out like when I was in high school doing the college tour with my dad up in Boston, actually. And so I knew I would somehow find a way to marry the two. I went to school, to be a registered dietitian. And when I finished my internship, I started working in a WIC program, which I absolutely loved, that counseling piece. Moved down to South Carolina and started working in a hospital and found out very quickly that the inpatient setting was not for me as a dietitian. But I found myself in a role as an outpatient bariatric surgery dietitian and found my home for sure. I loved the counseling. I loved the conversations, seeing patients long-term through all of that. But I did feel like I needed a little more psychology than I had in my formal training as a dietitian. And so I went through a online PhD program in health psychology, not really knowing where I'd end up with that, but knowing that I needed that background to just, be a good dietitian in that area. So that ended up leading me to want to do leadership in my program. So I was at the Medical University of South Carolina for a total of about 17 years as the dietitian and then the director. And then I kind of just, had a little bit of a change of pathway. This opportunity came about to work for SECA. I started really kind of imagining the role and how I could use my background to educate folks about body composition. And it's evolved. So it's been a little over 3 years. I've been on the team now. I get to work. I have somebody on my team helping me with education. So we're able to do a lot in the broader view of how to educate people on how to incorporate conversations around body composition. And then also once someone buys one of our devices, they get, we design the education and sort of troubleshoot how to use it, how to make sure you're optimizing it in your practice. And yeah, so that's kind of where I've landed. The education role has really suited me. And now I really have been enjoying kind of working in this role and infusing a lot more behavior into bioimpedance, which sounds like such a hard technical science. And so that's been a really fun role for me. So
I think it's a really important role, especially because we know that behavior change is like the holy grail of helping fitness consumers get the results that they want. A lot of the times there's something that's maybe not enough rest and recovery, but oftentimes it's starting with their eating habits where they want to see a change or go in a different direction with their health. And behavior change is really hard, frankly. As all the fitness professionals listening know, it's a real struggle. And speaking as a former personal trainer, I was amazed at how hard some of my clients were willing to push themselves, how enthusiastic they would be about the workout. And yet I could tell week after week, month after month, a lot of the topics that were not really my scope of practice that related more to behavior change, eating decisions, et cetera. Those were areas where I could tell they would have gotten a lot of extra mileage had I had the knowledge at that time that I do today, just in terms of getting the results they wanted. We know that behavior change is central, and obviously you're an expert on that. And it's actually really important for retaining members as well, because we're trying to support that habit of coming into the facility regularly, if that's their Monday afternoon pattern or their Friday night pattern, whatever day of the week it is, a lot of it's pattern behavior, of course. And we know that on the global scale, only about like 3% of adults are holding a health club membership right now. And in the US, we have a lot more health promotion, but even then it's just 20%. And I have a feeling if you looked at how many members actually come in every month, it's far lower than people realize. And this points to an opportunity for us. It's an opportunity to improve recruitment, but importantly, that behavior change piece, improve retention, right? So before we get to those best practices, I'm wondering if you could share what are some ways that you think facilities maybe unintentionally pushing new members away or pushing those people away?
I have a lot to think about on this topic. When we're talking about these days, it's interesting to hear that 20% statistic. Um, I hadn't known that exactly before, but it checks out. I think when we think about how people are getting engaged with exercise, movement, physical activity, however we're wanting to define that, the opportunity I see these days is that there's a lot more people who are thinking about fitness and movement than maybe ever before. We'll get into a little bit of talk later, maybe about the GLP-1s and the new class of medications. But one opportunity I think that's really driven us towards is being able to bring a new group of people into a fitness center setting that maybe have been turned off before. And so that turn off has, there's all sorts of different things in my practice as a bariatric dietitian. I've heard from minor to quite traumatic experiences of patients who, had gone in, and there's a lot around how they feel in their own body, how they're interpreted by others. We all think people are maybe looking at us more than they are, but there's a lot of, bias that they've experienced in that setting in particular. People making comments, about what they look like. Do they fit in? Do they feel like they fit in? And even stuff that's beyond what you're saying, or even the words on the wall or the motivational quotes or whatever that may be. There's also just that sense of, do they physically fit in? Are there chairs that are of their size to change in the locker room for some of these patients who are of a larger size? Do they feel out of place? And so there's a lot around just engineering the environment to make that a comfortable place. And then all the behavior stuff that you and I love to talk about so much, about how are people talking with patients? Are we simplifying? You just need to do that. Why don't you hop up on the equipment? Things that maybe are not within someone's, ability to do. Those type of language things are so important. So I think there's a lot we can do from a environment perspective. But one I love to really talk about and get into is, what are the words that we're using to communicate? And the goal really then, as you stated, is getting people in and making it a long-term habit. Because this is unlike some of the things that people do. The movement piece is something they have to do pretty much every day. How do we keep that pattern going? How do we keep them excited? How do we keep them motivated? And so this is kind of a neat space for us with body composition, because as our whole, hopefully, world and environment is moving away from looking at just someone's weight as the outcome, the body composition assessment has really been a nice way to say, like, hey, this is not the only important factor, even though everybody's got a long history probably of, being weighed, being, talked to about their weight, things they should do, all of that. Like, there is a shift, as subtle as it may seem, towards looking at what are the metrics, beyond that we can really make some movement in. And it's really being done both in their, kitchen and at home in the food environment, but really in the gym and in the fitness center space where they're doing, hopefully more and more strength training.
I've been loving the strength trend. Obviously, it is on everyone's mind. There's more and more studies showing how important it is, not only for younger adults, but also all the way through the lifespan, particularly for women, because as many listeners are aware, we have a much higher risk of fracture than men do as we age. I know it's been a big push for me to keep lifting weights, just the idea of falling and are my wrists and forearms going to be able to handle the impact? I think about this a lot more than I used to. But I think you really nailed something, that sometimes a person may bring a history with them to a facility, and they may have maybe been judged before or heard comments before. They're bringing that with them. So to try to get a more inviting experience, it's so important that fitness professionals meet them where they are. I know that sounds cliche at this point because people who study behavior change mention it all the time, but it really does matter that you meet them exactly where they're at. I had a client almost 15 years ago, and it was my first client who did not like mirrors and was really uncomfortable in the strength floor. Cardio, that was not as much of an issue, but the strength area, where to her, a lot of people knew what they were doing. They were approaching the dumbbell racks. They were, using squat racks. She had some intimidation combined with the fact that there were mirrors everywhere. Now, as a personal trainer, I love the mirror because the mirror is sometimes the quickest way to help someone adjust their form, because they can, immediately get that visual feedback. But it's not always preferred by people, especially if they're not used to that fitness environment or that gym environment. It can feel like, oh my gosh, you nailed it, everyone is looking at me. So there's been many conversations I've had with friends, loved ones, and clients to remind them that, hey, we're doing our own thing in here. It may feel like folks are looking, but they may just be checking to see if the bench is done, or if the 30-pound dumbbells are re-racked. Like, you don't really know what other people are thinking, but a lot of times they're in their own head, they're doing their own workout. And just to remind people, like, we're all here, we're united by this shared experience of trying to get stronger, fitter, healthier, whatever that goal is. It's a positive that we're moving towards, hopefully. You have a strong background in the clinical health space, so I think with patients, I'm sure it was even more important that you use the right language, the right phrasing, because it needs to be kind of behaviorally centered communication. And it's a critical skill, really, for fitness professionals today.
Completely. And I would say too, the culture matters, right? So if you're someone who's sort of grown up in gym settings, you know how it goes. You have to kind of assume the person who's coming in who has not been there before, they don't know. So there's a lot of, we've got to really, I would say, if we're going to take one thing away from that, approach it with curiosity, from that stance of, you don't have to know the answer, actually. You just have to, as a, maybe even as a business, be inquiring of your members, constantly, and saying, how does this work? And know that there's so many different experiences that everybody, you definitely can't make everybody happy in the same physical setting, but knowing that you're trying, I think, matters. And for people who don't feel comfortable, bringing them into that space where they see a little more representation. It's not that look of that full, that trim body and that, perfect physique everywhere. They feel like there's more like them. And I think that's a really cool, it's a cool thing. I think we're much better at that than we were in years past.
And I think you're right. Things are changing. So as personal trainers go through training today, they are trained with a curriculum that's much more guided to, we need to start people with things that they can do and achieve confidence in, and then we can progress and build from there, but starting small. But I have to say, because I was first credentialed over 20 years ago, and it was a little bit more prescriptive. Now, I've been listening to Dr. Nina Crowley doing a number of podcasts lately to just prepare. And there's a phrase that you use I want to bring up. You may know what I'm talking about right away, but the phrase that you're emphasizing, I found wonderful, because it really is that behaviorally centered approach. And that's the idea of shifting from a method centered approach. So there's a method to get stronger, lose body fat, whatever it is that your client seeks as a primary outcome. Maybe it's even stress relief, right? People are oftentimes working out for the mental health benefits as their main focus. But you suggest shifting from that method center, like, I have the answers, here's the method, to more of a member centered approach. And I think that's really clever, because it's starting to get you to think about, what are they seeing through their eyes? What is their experience like? What is going to help them realize that it's a very personalized, customized experience for them, which is what today's fitness consumer is starting to expect, really. This echoes that idea of meeting members where they are. So I'm just wondering, can you break down a little
Sure.
bit of what that could look like? Because it's a phrase that I got from one of your podcasts, and I was like, "Ooh, that's a nice one."
Yeah, well, I can't take full credit for that. Actually, Renee Rogers, who's an exercise physiologist, and you may know her, she's done some great work in this area. I've had her, working with us too. She does a really good job kind of talking about it's not a one size fits all approach, and in her work in the fitness industry, a lot more than mine. She has some qualitative research of people coming in and saying this didn't work for me because people I came in and I said this and they told me, well, I've got the answer for you. You don't need that medication. You've just got to do my hit program or whatever that may be. And so I think it's a nice frame. I definitely have been a big advocate of that person-centered, member-centered in this case approach. And so what that really is all about is just saying that what I actually love about it as the professionals or the experts, you don't have to know all the answers. So just like that curiosity approach where you're saying like, well, what works for you? What's your history? What's your experience been? I've done that even as a dietitian, talking to my patients back in the day saying, not everybody has had a positive experience with a registered dietitian. What's your experience been? To just level set and say, hey, let's see what that is. I've been honored to be, a few patients told me, hey, you've been the first dietitian who have actually felt comfortable enough to share this or that with, right? And I'm sure exercise professionals feel the same way where someone says, well, this relationship just, vibed, right? They felt comfortable. And so that's been, an exciting place. But I think it comes back to being curious and saying what works for you, what matters to you. We're hearing a lot of, I know the buzzwords are always, they're so tricky, right? Because we hear them so much, sometimes they lose their meaning. But personalization and really that individualization, that's in the same kind of conversation where we're saying, there's a lot of research, there's a lot of evidence out there about what's the best, right? Air quotes, of course, around the best approach for someone. And so there might be actually, in fact, there could be the most researched thing that would work for most people. But if the person is not going to do those things, it really doesn't matter if that's the best thing for them, whether that be in the exercise or the nutrition or any realm, really. And so it's really this sort of dance between finding out where the person is starting, what their goals are, even if their goals are totally weird and wacky and different from what we would think. Okay, that's something I would never have thought that, this person's biggest goal would be to get on the floor with their grandkids. I hear that one. I used to hear that one all the time. Get on the floor and be able to get back up, I should say, right? So, that's a goal. Well, to a, athlete, that seems so like lame and basic and boring, right? But for someone to be able to do that who can't even get close to that right now, that's where you're starting. And that's where you're taking that person to. And once they get to that, that's the beauty actually I love with fitness goals is that unlike some of the medical goals that you set, you meet, and then you're sort of stable, fitness goals, you can always achieve more. So there's really no cap to that, no ceiling for, hey, I want to get to this. You can constantly improve and as you age. And I think that's such a really exciting piece of goal setting and behavior change is that, we talk a lot about it's not just about weight. Setting your goal for a particular weight is so tough for so many reasons. But a big one is that once you get there, then what? Right? It's not really all that motivating to continue to work to stay the same, no matter what the goal is. And so I do really think that the kind of the overlay of not putting your method on a patient or person, sorry, I say patient, that's just my language, right? But for the member to not just have, hey, this is what we do here. Everybody gets the same goal. Because these days with AI, like you could do that without the human in front of you, right? Here's your goal, here's your plan. And maybe even, AI is maybe a whole nother story, but you don't need that provider or experience from someone if that's the case. So you really got to sort of do that dance with where's the person at? And then you get to share the evidence. And really, it's kind of an evidence-based approach. I feel like I talk about this all the time with evidence-based practice because that's a buzzword. And what people hear, I think when they hear evidence-based practice or approach, they hear evidence and they think that means research, right? So again, what's the best thing to do? But a true evidence-based approach includes the provider or practitioner experience and the patient or person's values. And those are always those understated pieces of like taking the information that might be the most evidence that we have at the time, along with your experience of, yeah, when I go that route and set someone's goals too high, they don't achieve them and they don't come back. Well, that's not working. And then to the person, hey, I'm telling someone what they should do and they're not doing it. And then they come back and they didn't do it and you're upset and they didn't meet their goal. So they're upset and that doesn't work for anybody either. So it's really this sort of paradigm or maybe, framework to be thinking about how we practice from a movement activity, perspective. And along with all the other things that we have to do in the realm of behavior change, it's a really nice, approach. So I'm glad to hear that resonated with you, but I will always defer to Renee on that one because I think she does a really good job talking about that. So we should maybe even link to some of her stuff too.
Definitely. That's Dr. Renee Rogers. I've been reading her papers along with her mentor for over a decade now. So it's a name I'm familiar with, especially in exercise science. I wanted to circle back to highlight some things you said that are really important. One was that we're talking about real baselines where someone really is at the moment. And then, what you're describing is an empathetic approach where you are prioritizing active listening. And I will admit that in personal training, especially when you're getting your cert and you've got your first few clients, it's a lot more prescriptive at the beginning because you don't necessarily have all the tools yet to understand the progression, the regression. So it took some tinkering, at least for me, a few clients, a few years, some practice to get better at really being better at listening.
Mm.
But really, I think the true thing, and you nailed it, is that fitness professionals have to develop these communication skills because AI is ever present and available for most people. And you want to bring value to that experience so that they want to come back. If you can listen, if you can tailor your approach, I loved how you talked about positioning the training in terms of their values. Now you're building a relationship, and that's the glue, in my experience, that leads to business success. It's those relationships that are forged. Even though most of the people working out are probably wearing headphones and don't always have a lot of chit chat going on, there are some people there who are seeking support, guidance, and they want that person to be maybe a accountability partner. I know that gets like a bad rap, that phrasing, but someone to help them with the structure and it will be noticed if I don't show up. That
Mhm.
kind of matters at the end of the day. So I really like a lot of those points that you're bringing to this person-centered, this member-centered approach rather than the method-centered approach. So not all facilities are going to work well with that because like something like a CrossFit, they've got a daily structure, but they can still be supportive in the conversations. They can still adjust. And I know many CrossFit leaders are good at helping that person scale down the workout if they're new to it or adjust if it's a skill or technique they don't have yet. But overall, I think these are great universal ideas, and they're born straight out of that behavior science research because we know that it works better if it's a collaborative goal setting opportunity rather than just a goal being foisted on you. I will share a brief personal. I've had doctors look at BMI because BMI can be high or low, and that doesn't really tell us your body fat. Body mass index, of course, is based on weight and height only. So I have had doctors tell me that I need to lose weight and then physically look at me and go, "Oh, no, you look fine." I don't like those experiences. And I know it's the doctor's job to notice if your BMI is over a certain number and offer counseling. But this is much deeper than that. This is looking at what is a person's goal? What is their vision? What makes them feel good? What is something they want to work towards so that it's not always a loss framed message? It's about how much weight you lost. No, it's sometimes about what you gain in the fitness, the strength, the flexibility, whatever their goals are, right? Even just peace of mind. I go to the gym to de-stress, or I know that that's maybe not an accurate way of looking at it because exercise is a stressor, but it really helps me put my life stressors in perspective. So I love that the behavior science is really starting to impact the members, the patients, anyone who's looking for a healthy change. We know that personalization is evolving fast in fitness. Some of it is augmented by AI, of course. But when we talk about body composition and this personalization issue, there's a lot of weight related language. These are phrases that come into play. Um, and if you could just like wave a magic wand and shift a few fitness industry norms around weight or appearance or the language, is there anything that stands out that you would want to change?
Oh, yeah, well, that magic wand would be handy for a lot of things in life, right? So yeah, I think, magic wand for me would be getting rid of that scale as just a deciding factor for anything, right? People's weight fluctuates so much on a, daily, weekly, monthly basis. And so it's just, it's such a trigger for so many, adults that I've met now. Um, that they focus on, and little decisions and things like, hey, my weight is here. Oh, I shouldn't have ate that for breakfast. Or, hey, my weight went up when I did that particular workout, so maybe I won't do that anymore. So like making decisions based on that number, I think, is such a hard thing to unpack and unravel for most people who've got years and years of doing it. I always think for the younger generation, I think that they're probably in a little better position because they don't have as many years of kind of that negative messaging around all of that. But I think there's still hope for us as the, maybe 40 plus who have been in this world for a little bit longer. So I would say getting rid of that obsession around, scale would be a big one. I would also say from the sort of person entering the fitness space, being able to know that there's trusted people on the inside that are going to listen to you and take your experience seriously and not just tell you you've got to do something that's way outside their range. Or I think it, a lot of the TV shows and some of the social media around people who are just like drill sergeant, like, in their approach, that's not what most people are looking at. So just knowing that it's going to be personalized, I think is big. Um, and be able to sort of have that relationship. Again, there are so many things we can get at home, whether that be, virtual, even through COVID, right? We talked a little bit about this last time we spoke. People move to doing a lot of their, workout stuff at home. It, you've, what I think is cool about this industry is behavioral adaptation happens, and right, like you do a thing for a period of time and then that thing's either no longer exciting or maybe no longer works from a physical standpoint. And so there's constantly change in the industry to keep people excited to do the thing, which is great for business, right? But reminding people that there are benefits to doing this work in community with others like them, with others not like them, and being able to build a community around movement that works for them. I think that's really exciting. And so, the more we can foster that and have that be accessible and have that, match people's personal goals, I think the better.
Yeah, you touched on something, that focus on the scale and how much that scale goes up and down. Did I have a salty dinner? Am I drinking a lot of water today? I mean, there's so much that changes it that's not actually related to oftentimes the results we're driven to achieve. Um, I do have a brief story. When I was in Southern California, I wanted to join a gym in Irvine, where I lived at the time. I was at UC Irvine for my postdoc. And very awesome looking facility. If anyone knows Irvine, California, it's nice. Like the facilities are newer, it's not a facility. It's not, nothing seemed old. Everything seemed new. And I walked in and did the intake, and a young gentleman working there, one of his first questions for me was, and he said it with a very positive look on his face, is, how much weight do you want to lose? And he had his paper out and his clipboard. And I was like so offended. I'm just being honest. I just was shocked that that's his like first question. In my head, I was like, I'm working on like handstands and squats. Like that's not even in my, so it wasn't really his fault, because probably most people who entered, that was a reasonable question for most people, but I did not like hearing that. And I just think that as today's fitness professional continues to evolve those communication skills, talk to people about what their experiences are in the gym. Because every now and then I talk to someone who's been to a health club or a fitness facility, and I don't let them know what exactly I work in, but I like to hear their stories. And they'll tell you about an instructor who was so charismatic, energetic, whatever. They'll talk about a personal trainer who was so motivating. But unfortunately, many of them, especially people in larger bodies, have stories where they felt that body got in the way of being viewed or treated the same as someone else. So fat stigma is a real thing. And even if it's in a subtle form, like how much weight would you like to lose? You know, he did not mean anything offensive by it, but I was offended. And I found that it tainted my 2-week trial because I wanted to stay there, but I would just keep seeing him and thinking, wow, he sees me walk in and his appraisal of my body is that I need to lose weight. It should not have mattered to me what a stranger thought. It should not have mattered to me, but it did. And I only mention it because it really helped me as I personal trained on the side. It really helped me be more careful about the language I was using, or just assuming that someone has a weight loss goal, which they may not, even if their body objectively is larger than average, right? So I think a lot of the points that you're making about meeting people where they're at, treating every person as an individual, instead of making assumptions, ask questions and listen. These are such good points of advice because you don't always get a lot of time with that client or that member or to develop that relationship. So you don't want to start off on the wrong foot. I would say it's the wrong foot for me to ask me how much weight I want to lose
Yeah.
personally, but other people, like I said, it may be a fine question. I'm sure they've revised their policies. This was like 2011, so it was a while ago, right? But you know, you're highlighting something important. It's that people maybe face different treatment in fitness spaces, or they're more sensitive to different things. I know I was sensitive to that question, obviously. Um, but for a facility that's trying to be truly welcoming, I'm wondering if you could share what are some common misconceptions about body size that could be shaping that bias, or that assumption that they're making, or that's limiting how they're supporting their members.
Yeah, well, you mentioned earlier on one of the things that I'm most passionate about is the is weight bias and stigma, and so I work with a group called the Obesity Action Coalition, and it's a patient advocacy group that does support and education and advocacy work for people to have access to better care, and they have that group has taught me so much about the experience that people have living in a larger body and how they interact with healthcare and in movement and exercise and all of that. And so it's really cemented the idea that you never know someone's experience, right? And so I think in weight bias research and how we can like minimize our own bias that we have, one of the things is looking at like counter exemplars of like people that defy the sort of stereotype that you have. And so one of those things to me is always remembering a patient that I had who came in to see me, and they, were in a larger body. I would say they probably, if I had to think of their weight, were in like maybe 250, 275 pounds. And so initially that sort of thought was, hey, you're here to talk about weight loss surgery? That was the clinic that I was in. So I made that assumption. Well, it turned out this patient was here to transfer care. They had in fact been over 500 pounds when they started on their weight health journey. And they, were very happily and very, stable in their weight post-operatively. They had been a fabulous success of an outcome from a surgical perspective, but just by looking at them alone, you didn't know that whole past story, right? So I always use that type of an example. The other one that I use, is that if losing weight or maintaining your weight loss was easy, I mean, would Oprah Winfrey struggle so much, so publicly over all of these years, right? If it was just as easy as having money or having people to help you do the things, she'd have mastered that, millions of dollars ago, right? And so I think thinking about people that are in those other experiences can really help us to frame what that assumption pathway looks like for us. And always, again, the easy part of this is you don't have to know the answer. Like, we all went to school to like learn all the information so we could just tell it to people. But that was sort of the fundamental problem, that you only learn through, as you eloquently said, through experience and tinkering around and playing around and saying, oh, actually, I don't need to know the answers. I just need to be a good communicator and a good human, to listen actively to someone's experience, and then, you know, neutrally ask them what they're here to get out of this experience, because it's going to be a nicer experience for both of you, not to prescribe them something that they're not ready for, or that's too much or too little. In that other way, that's offensive, right? Like, I have athletic, very, very strong athletes who live in larger bodies, but could do so much more than a thin person with low muscle mass, right? And so that does almost get into kind of the role that I see body composition playing in the assessment piece, is don't make any assumptions about the, fitness plan or what the person's going to do, but just start off from, we're just going to do a baseline assessment and see where you're at. Part of that includes looking at your body composition, understanding that your weight alone doesn't tell us all we need to know. If we need to be working on reduction of your adipose tissue or strengthening your muscle mass or location. Maybe your total body fat is in a place that's normal or okay, but it's all around the middle in your organs. Well, that's not something that we want for certain health goals, right? So I think kind of framing it in, let's take a look at where you're at from a body composition perspective, and then set some goals, and then do some work towards that, reassess, and think of it almost as like this. It really is kind of a lifelong relationship with exercise. And while the facility, the provider, the trainer, those people might change, I think it's part of all of our responsibilities to help people develop a positive relationship where they do want to come back, even if it's not to you next week, but that they're going to be a lifelong person who finds enjoyment and joy out of the experience. I think that could be a goal that we all would say is something that would be, a public health success.
Absolutely. And you're pointing to something, is that what is the quality of this interaction? Do they feel better as a result of chatting with me, or do they feel worse about themselves? Am I asking questions in a positive, neutral way to find out more, or my questions have baked into them some assumptions that might not be ideal for that smile that we're all trying to get to when we chat with new members or we welcome someone into a facility? I think that this has been a great conversation. I know that we could really dive in deeper. So next time we can dig into how to help members understand the value of body composition, because it is an excellent way to really reflect to them the outcomes of their efforts, whether that's in the strength area, the cardio, mind, body, you name it. And in the meantime, more conversations are available. So please check out other episodes of the Research Hub podcast on the Matrix Fitness Global YouTube channel. Thank you so much for joining us today, Dr. Nina Crowley. We will see everyone next time.
Thank you so much. Loved our conversation.